Great. So yes, thank you. Welcome, everyone. If you could put your name and affiliation in the chat, that would be great. We have a full meeting today. We are going to, oh my goodness, this is great. We're going to start with Dawn. Dawn, there you are. Dawn is going to start off our meeting with some updates from the Child Development Division. And then we're going to welcome a panel about 10:30. And so if we have any space in between Dawn's updates and the panel, then we certainly can have some time for general updates. The panel is going to be moderated by my colleague, Jen Horowitz, who's here today from Let's Grow Kids. She was essential in setting up this panel for us, which I'm super excited about. And when we get the panel, hopefully I'll remember to say this again, but when they're here, there will be time for discussion and questions. And it would be great if you're going to ask a question of the panel, because we won't have time for everyone to introduce themselves, but for you to be able to just say who you are in your role. So when they're thinking about your question, they can kind of think about how it relates to your role in working with young kids. So with that, I am going, does anyone, Dawn or Beth or Jen S., do you have anything else before we turn it over to Dawn?
Nope.
Great. Dawn.
Okay, well, good morning. I have my little notes as to what's happening at the CDD, and I am certain that I have forgotten some of the things. We are an exceptionally busy division in every part of the world of us. So first, I'm going to start off with some readiness payment updates. As of Tuesday, which was the last check-in that we had with the person who's processing the applications, we had 631 applicants. So a very impressive showing for just a couple of weeks of having the application open. Eliza said she had at that point processed, and by that I mean she was getting them ready for finance. She had processed all but like 130, and she thought she was going to have those done by today. She's processing them as they come in, so she's actually being incredibly efficient. The award letters, we finalized. We didn't realize we hadn't finalized it on Tuesday, so now she has the letters to start mass emailing the amount of awards for programs. So that's actually, to get the word out that some folks thought that the awards were much smaller. They're actually very significant awards. We have a mailbox that has been used well for questions. Eliza takes most of the questions. I'm also co-monitoring the mailbox, so sometimes people get emails from me answering their questions. But again, please encourage people to email. We're very quick with our responses. I've been really super pleased about that. The files began going, so the files, which are the application files, began going over to finance Tuesday afternoon. So that means finance is preparing them to send them on for payment processing. So we're looking forward to sticking with that end of September payments going out date. Finance needs to make sure the files, and they say files to me and I don't exactly know what that means, but I believe them. They have to be clean, and so they have to check them before they can go on for payment. So again, we're pretty excited. We expect all of the files that we have, all of the apps that we have by probably Wednesday to be able to go forward for that payment time. We have had a couple of questions from newer programs asking that question about when they can apply, what time period that those applications will be quote unquote good for. And we explain again that your eligibility starts the day that you are open. So that we've encouraged them that as soon as they open to put in that application. Applications are going to be accepted right up until like beginning of February. So if somebody's open now and applies at the beginning of February, they will get the September through March payment chunk just in a like 2 checks instead of 6 checks. The other question that I've been getting quite frequently is the eligibility of public UPKs. And the rule of thumb is that if you don't accept CCFAP, then you are not eligible. So if a public UPK has an extended day and is accepting childcare financial assistance, then they are eligible. However, most of them do not, and so they are not. The other sort of side question to that is summer only programs. And those programs are not eligible. However, after school programs or wraparound programs that are open throughout the year, absolutely eligible. Trying to think of any of the other questions that have popped up. I'm sure I'll remember, but if you have questions, when I'm done talking, please ask. We have a meeting once a week to check in, Janet and myself and our finance / processing team to just make sure everything is going smoothly and that we're kind of keeping an eye on the various questions that are coming in. Yesterday, well, actually all this last 2 weeks, we've been meeting about the last round of ARPA funding through September 2025. So I expect that there will be some decisions coming out fairly shortly about where the money is going to be invested, the last chunk of ARPA money. I think you're going to see a lot of similar programs to what we've funded in the last couple of years, and then hopefully some additional resources being designated for a couple of different arenas. Act 76 is still one of our primary focuses. There's lots of talk about, or lots of work, I shouldn't say just talk, there's lots of work about getting CDDIS ready for the next transition of rates and eligibility. So that's hard at work. We're also thinking about the various reports that are going to be due to the legislature and how to approach those. And we're feeling pretty positively, particularly around the readiness payment. We feel good at how much progress we were able to make on that front. We have a number of positions open at Child Development Division, not only from the Act 76 positions, but our PDG positions are also being posted. So again, if you have folks, I think BBF is going to be doing sort of an email blast about those shortly. If you know some folks who would love to work for an awesome team, with an awesome team, then send them our way. So things like that PDG manager, grant manager, a new STARS person, given Joanna retired. I'm still very sad about that. So we need a new Joanna. I know that's a hard bar. I shouldn't say that. That's a high bar. However, we have just welcomed Helen I always get Helen's if it's Mathis or Matthias. Helen has been Mathis. Thank you. I should imprint that. I'm terrible with names until I imprint them. It was terrible with undergrads too, because I would look at them for at least a year and think, I know your name. I just have to imprint you, and then I never forget you. She has accepted the position that was vacated by Amy Bolger. So she is going to be one of our new systems team members. Some of you may have known her as our ARPA grant person and grants and contracts. So we're very excited that Helen has made the leap. She has an extensive background Thank you, Math Ice. There you go. Thank you, Lynn. Math Ice. I'm imprinting it now. But Helen has an extensive background in education and educational systems, so we're really excited to be adding her expertise to that part of our team. Let's see, our workforce bonuses just ended as of 8/31, so we're trying to wrangle people in for their invoices for that program so we can put that one to bed. SAGs are being reviewed right now. There's a round that's in process of being reviewed. I think Keith is here, so if you have SAGs questions, I can direct you to him. And then finally, Ray and I met this week and started to truly map out the infant toddler credential. That is one of my personal priorities. So I am eager to get some sort of RFP or, oh, thank you, my goodness. I think you know what? I've only been here a little over 6 months and I had no idea what these acronyms were when I first started. And look at me now. I'm just whipping them off left and right. So yes, if you don't know what I'm talking about, say, Dawn, I don't know what you're talking about, because that's what I spent my first 3 months doing. What is that? What is that? So I'm hoping that there'll be more news about the infant toddler credential in the somewhat near future, because I really do want to see that launched. And that is my update. So if folks have questions, I'd love to hear them or see them. I'm so proud of us. We're doing so.
Don, I have a not related to what you just shared, but just a general question that I had thrown to you earlier this week that might be helpful for everyone to hear around STARS and what might be some steps that people are wondering about as Sparks is getting set up. Maybe Sharon can chime in too.
Oh yeah, yeah, absolutely. And Sharon, absolutely jump in. I know your folks have been in the process of training in the last 2 weeks. We are still doing webinars. I've actually been doing the last couple of webinars on the CQI process. So those are available on our STARS website. They're well documented. We record every session that we do, so folks can, if they're so inclined, they can watch multiple ones to see if there are any additional questions asked that they might be interested. On that STARS page, there's also all of the documentation, including the guidance manual, which is something that I've been pointing people to, that has a lot of those questions, specific questions about sort of the STARS process, how to get started on your CQI, what we mean by this as being the hold harmless year, sort of how you progress that CQI through the STARS levels. And so those questions are definitely being answered through those venues. And we should be scheduling a few more STARS sort of info webinars in the near future. We just haven't coordinated our calendars quite yet for the October ones, but I think we've put together a really robust web page with resources, and then of course the videos. And some people love the videos rather than reading the resources, which is completely valid. And I'm going to kick it over to Sharon about what's happening with Sparks.
So much. It's very exciting. So I want to just build upon a little bit about what you just shared, Dawn, related to STARS. And so there's a few things that I think are really important for this group to know. First of all, we have one assessor hired who is still being trained to provide assessments. We have either 2 part-time or 1 full-time assessor positions still to fill. We are building the intake system, which is, part of how programs will be prioritized, and working closely with Vermont After School and the Child Development Division to think about what that process will be. So we would anticipate that the earliest we will be able to have programs begin to receive assessments would be late October or early November. And because we are obviously onboarding and training staff to be able to do that. And so we have a training scheduled for the quality support specialists and the assessors in October. And so I think that when we talk about, you know, the questions that we're receiving specifically about when can I have an assessment, and we are receiving inquiries, you know, programs that are looking to be specialized care, people that have, you know, programs that have renewals. I think it's important to have a sense of that timeline. And we anticipate a lot of interest because everyone is really excited about this new process. So speaking specifically related to Sparks, I'm excited to say that joining us today is Victoria Ward, who is the Associate Director for Program Quality at Vermont AUIC, and she's leading the Sparks team. We also, on another team, have Beth Wallace here with us today. She's the Associate Director for Early Childhood Educator Engagement, and she'll be leading the Student Loan Repayment Assistance and also supervising the connections to the intake system and also the Vermont Early Childhood Networks. So I'll put a reminder in the chat later about the Early Childhood Network survey that's out, that we're really looking for a huge response for people who are engaged with early childhood networks, as well as those that might not be, to help inform how we can best support early childhood networks, which falls under Sparks. So that's kind of why I went down that path. The Vermont AUIC has onboarded in the last month 12 new employees, and they're all being oriented to the organization, to Vermont systems, if you know, because they're bringing their individual perspective to the system, and everything related to Spark. So 6 of those are quality support specialists, one who hasn't even started yet, are learning stars alongside the field. So there's a little bit of, frankly, a little bit of anxiety, feeling a lot of pressure on that team to be prepared to support programs when they are learning it alongside them. So they are deep in self-study and group learning to be best prepared to support programs on their quality improvement. So as we phase in Sparks, you know, the assessments will be the first phase. Early childhood networks we've been supporting them since this transition, and will continue to do so. And then the coaching and technical assistance piece and mentoring will roll out a little bit later. So there is the opportunity to sign up for a Sparks specific e-news. So I encourage you all to spread the word that the most up-to-date information will be communicated in that. We're building the website, which will have the resources and all of the components of Sparks and some other collateral to support the announcements. Hiring, as I think I said, we still are looking for assessors, so please spread the word. I'm not sure, I think that might be enough.
Is there any questions for Sharon or Dawn around what's happening, all that stuff that's happening with STARS? Great.
I know I keep reminding, you know, like we just need to give ourselves a little grace. Like everybody just needs to take a deep breath. It's a big change, and just we're gonna all get through it together. But you know, give ourselves individually and collectively a little grace.
Dawn, that's exact. Like you are like word for word what we shared with our team this week. Word for word.
It's okay. Like it's, you know, there's going to be questions that pop up, or we didn't think of this and we need to think it through, and that's okay for everyone. Everyone, it's okay.
It's a huge lift for sure. And it's exciting, but it is a big lift. Awesome. I think Beth and Michelle have a Building Bright Futures update to share.
Yeah, thanks, Sherry. Good morning. Beth Trzanski, Deputy Director at Building Bright Futures. I'm recovering from COVID, so I'm sounding a little froggy this morning. Sorry. I just want to invite folks to the State Advisory Council meeting on Monday. We will be presenting the 2024 policy recommendations Those have been developed in part with input from this group. Thank you all for your we've reviewed over the last several meetings, and those policy recommendations really come from the BBF network, both regional councils and BCAP committees like this one, identifying what the pressing kind of policy gaps are in our state that we feel like need movement in the next year. So those will be presented on Monday to the SAC, and then continue to make adjustments and brought for endorsement at our October meeting. So I will put that invite and registration link in the chat again Monday at 1:30. It's a virtual meeting. I am going to introduce Michelle Kersey, who's our Vermont Early Childhood Fund grants manager, who can give a VECF grant update.
Hi, everybody. It's good to be with you here today. So I want to let you all know that if you visit the VECF page of the Building Bright Futures website, you can get some information on the next round of grants through the Vermont Early Childhood Fund. We expect to be sending an email announcement of the grant application portal opening sometime very soon. So keep your eyes out for that. I'll go ahead and put the link to the webpage in the chat box, but you can see a preview of the application for both grant programs that we'll be offering this year. So if you plan to apply, you can at least get a head start. And that's it for me. Thanks.
Does anyone else? We have about 5 minutes before our panel arrives. Does anyone else have any updates to share?
Hi, Sherry. Sorry, I sent it in.
Hi,
I sent it
Amy.
in the
I was
chat,
gonna-
but
I was
that's
going to
okay.
call on you because you usually do have updates, but then I didn't want to put you on the spot.
No, that's okay. So Agency of Education, early MTSS, we can update the Title II and Title IV grants that we started last year to scale up our early MTSS work continues to be underway year 2. So year 1, we worked with 8 universal pre-K public and private universal pre-K programs. This year, we're adding another 10, so there'll be 18 total on that side underneath that grant. The state personnel development grant is underway, and so kickoff for that is going to be later this month. We've met with the vendor. They're all set. We're actually really excited because Pyramid Model Consortium is pulling in Aaron Barton. So if anybody's familiar with Barton Lab, that's through Vanderbilt. They are huge in early childhood work across systems. So we're very excited that she's going to be a part of that team and supporting programs. So under the SPDIG, the State Personnel Development Grant, we're working with Part C. So that's CIS and early intervention both are going to be working in the early MTSS world. So we're scaling out that way. And let's see, so this year will be year 1, and then there will also be a year 2 of that work. The preschool development grant, the PDG, that work continues, and we're doing that with alongside our partners at CDD, Child Development Division, and Department of Mental Health. So it's kind of a 3-legged stool that we're all working together with the PDG, and that's going to include childcare, so scaling out early MTSS and pyramid model to childcares, and we're hoping to at least add a total of 20 implementation sites under that. And then finally, the early MTSS state leadership team is underway. We've completed year 1 of that. We're now breaking into work groups, individual work groups. So there's going to be a work group for leadership, a work group for professional development, one for data and evaluation, also addressing mental health and marketing. So looking at early MTSS and how we can continue the scale up and expansion across Vermont, the early childhood system. And basically those groups are meeting every other month with the whole group meeting on those off months. So that work continues, and just kind of looking at areas of strengths and gaps, you know, in our early childhood system, and how we can use the data to drive, you know, what is needed for each and every program, you know, whether it's family-based childcare, universal pre-K, you know, just across that early childhood system. So that's it from the AOE.
Amy, I saw in the chat, and I apologize for not, I can't get rid of, my chat is really tiny, and I almost canceled us out of the whole meeting because I'm trying to get rid of the participant list. But there is a question in the chat.
Sure, Meg. So
Yeah.
early MTSS, Meg, you want last year's and this year's programs?
Yes, please. And I think other universal pre-K coordinators would also be really interested in who is getting those supports.
Okay.
Becca and I have a list of the UPK coordinators, so we're happy to share it if you give us the list.
Well, and I was thinking, you know, Wendy Scott, you know, who's on our team, you know, she's our UPK state coordinator, you know, we can get that, sure. And just to put it out there, so everybody's aware, these are not programs that, you know, were in trouble or anything like that. These are just programs that said that they wanted to learn more, or they needed additional support to be able to address children's social and emotional development. And so, you know, these programs that are working under all of these contracts, every program that becomes an implementation site, whether it's early intervention and CIS, or if it's under the Title II or the PDG, they're going to receive the free coaching and they receive the free trainings. So I think that was something that, you know, we were getting feedback and interest. So that's kind of how that, you know, came about, and programs reached out. And when we looked at programs, you know, in case people are wondering about that as well, people that were reaching out to us and were being identified as potential programs, then we kind of looked at a map of the state to make sure that we were hitting all of those, you know, regions. So not any one region was left out. So just if anybody was interested in that. But thanks, Meg. Yeah.
All right. Thank you, Amy. Any other questions for Amy? Great. I see our panel is arriving. And I am going to turn it over to Jen Horowitz to do a little intro and lead this part of the meeting. So, thanks, Jen.
Thanks, Sherry. Good morning, everyone. I am also froggy because my kid brought home whatever is going around now at school, and we all are sharing it. So apologies for any coughing or frogginess. We are so excited this morning to welcome a group of folks, both other state leaders on practices and policies to limit or eliminate exclusionary discipline. And over the past year, Let's Grow Kids has been working with a number of national technical assistance partners. We're so excited to welcome them here. And we are also welcoming folks from Maine and Arkansas to share some best practices. There are a lot of states using different approaches, including Vermont. And this is really an opportunity to learn about what else is emerging as best practices and hear a variety of experiences. So Maine is a regional experience. Arkansas is doing some really creative things, also using a pyramid model and integrating. So this is two of many options that we could invite everybody. But the way we're going to go through this is we're going to hear from some of our national experts first, and then we're going to hear from states and then have time for discussion. So as you're listening to folks present during the first section, if you wouldn't mind jotting down your questions, you can drop them in the chat. I'll try and keep track of them. And then during discussion, I'll try and go through questions that are already in the chat. And then if you wouldn't mind using the raise hand feature, if you do have questions as we're going through, just so I can try and keep track, because we are now on 3 pages of folks who are participating in this meeting. So without that raise hand feature, it's really easy for me to lose track of who is trying to speak at a given time. So now that we have logistics out of the way, I think all 3 of our national folks are here. Sheila Smith and Dan Ferguson from the National Center for Children in Poverty, and Carrie McCann from Build Initiative. And so those 3 folks are going to start us out talking about a little bit overview about the work that's been happening related to exclusionary discipline, kind of giving us that national context, and then we'll hear from Maine and Arkansas next. Somewhere on here, I know I saw Carrie join. I think I saw Sheila and Dan as well.
Yep, I confirmed we're all here. Hi, I'm Dan Ferguson. I'm with the National Center for Children in Poverty. Thanks so much for having us here today. We're really excited to share what we've learned on the national level, and then to have our state partners share what they're up to with you as well. I'm joined by my colleague Sheila Smith, who's the director of the National Center for Children in Poverty, and we're at the Bank Street Graduate School of Education in New York. And we're also joined by Carrie McCann, who's with the Build Initiative. And then they'll start and give us a kind of overview of what we see as the main issues and policy considerations from work that we've done at the national level. And then we'll turn it over to Nikki Edge, who's with the University of Arkansas for Medical Sciences. And she'll talk a little bit about the work that she's been leading there with their Behavior Help Warm Line and other expulsion and suspension prevention efforts. And then after Nikki, we'll have Amy. And Amy, I'm sure you've said how to pronounce your name, but is it Beaulieu?
Yeah, very good.
Okay, good. We'll be joined, who's leading the work that Maine has been doing around mental health consultation, and she's with the state. And then also she'll be joined by Rita Furlow, who's done a lot of work on the advocacy side there. So I will turn it over to Sheila and Carrie to start the presentation that we've put together, and I'll share my screen too.
Thank you, Dan. Hi, I'm Carrie McCann. I'm co-director of state services at the Build Initiative. And I think, Sheila, you and I have been working together for more than 5 years, I think, at this point, on expulsion and suspension prevention. And I would really like to share with you that we see this as a lever, as kind of the late stage of things that are happening in states that really there's a whole bunch of broader continuum around helping providers and young children around social emotional development. And really expulsion and suspension is a lag or indicator that's letting us know that things didn't go well. So as we kind of think about how do we prevent expulsion and suspension, there's really a continuum of places where we could intervene and support really in the prevention side of the whole continuum as we think about what's best, what your state has, where you would like to go, and what challenges you're facing. So Sheila and I thought we just have a few slides because we can always answer questions later, and we always think it's much more exciting to hear from peers in other states who are grappling with similar issues as your state, and that we can always follow up with questions or more information as we go. Yeah. So I think you're all probably very familiar about why this is a problem and how do we want to ground ourselves in children and families of who is likely to be expelled. And a lot of this research came from the seminal research that Gilliam did back in 2005. And so we just wanted to put it back up in front of you, knowing that you probably already really know this information about who's more likely to be expelled. But what we just wanted to point out is that kind of regardless of study, and individual states have continued to do studies about their own expulsion and suspension rates in their states, that there are significant disparities by gender, age, and race, and that these risks are multiplicative. So that really means that if you have a child who is a boy who's 4-year-old and is Black, then those kind of risks for expulsion increase with that combination than if you were a girl who is 3 years old and white. We are seeing expulsion and suspension across all children and ages and that kind of thing, but where the emphasis is and where the rates are highest, these continue to be kind of systemic across the country. The other thing that we wanted to really ground you in is what we know from research. So research can't completely tie for us, like when these things happen, expulsion will definitely happen. But what it can show us is what increases the likelihood of expulsion. And what we really want you to take away from this slide is that you see that it's a complex issue, that there's several things happening all at once, that this is also a chart and it kind of can feel linear and it can feel like one thing's happening. But what Sheila, Dan, and I are seeing across the country is that these things interact with each other in our early care and education system and its connections to other kinds of family supports or human services. And that's what we have to tease apart, and what we have to help the field do is that in any kind of case where expulsion and suspension is happening, what's the unique contributing factors that are going on that would really help prevent it from happening. So what you see here is things around structural quality. So this gives you kind of the definitions around high ratios, high teacher stress, too little or too much classroom structure. Organizational capacity is really how do our providers experience the day? Do they have lack of time to reflect? Do they have time to respond to parents? Are they afraid of losing staff? So kind of the interaction of the practical with the structural quality that our systems are kind of funding and supporting. And then there's this kind of interaction between knowledge around child development and social emotional development in particular. Are our workforce grounded in the knowledge and skills that they need to really understand what young children's behaviors is trying to tell them? Are they grounded in the context of family, community, and cultural expectations? And how does that help them negotiate and respond to young children and their families? We definitely are seeing racial disparities in discipline, and that's kind of the interaction that leads to those disparities and interactions with the disparities that we're seeing, and that you can really see that it could interact with, you have perceptions and underprepared. So the lack of knowledge and skills interacting with implicit bias then contributes to the kind of disparities that we're seeing across the country. And then we want to really acknowledge that there are children that have experienced trauma. There are rough situations for our families. There's emotional or relationship kind of issues that children can sometimes be born with. And so that you see here from 0 to 3, an expectation of somewhere around 10 to 14% of our population is going to have social emotional issues that we'll need to support, and that the early care and education system will need to be prepared for. And then there's growing research, and it's tentative at the moment, about other kind of systemic issues. And this is where it's kind of related to the broader early childhood system, where food insecurity, housing insecurity, and homelessness for certain populations of young children can increase their risk of expulsion.
Thanks, Carrie. Well, as Carrie said, we have been working together for several years on this issue, and what we've come to see as kind of the problem of expulsion and potential solutions is really based on the research Carrie talked about, and also our view of what some states are doing that really suggests some successful approaches. So we wanted to just share a kind of high-level overview of our perspective on expulsion and solutions based on our experience of the past several years. And the first point is one Carrie alluded to, and that is that expulsion really is the tip of the iceberg. It often suggests problems with basic quality in early care and education programs. So often in programs that are using exclusionary practices, we see that teachers are not using practices that promote positive, nurturing teacher-child relationships, or promoting children's social emotional development. And I think the good news about that is that we really get more bang for our buck when we work on preventing expulsion with the types of program supports we'll talk about and hear about today, because that work is not just preventing expulsion, the kind of end bad outcome, but is also doing something very positive towards promoting children's social emotional development as a foundation for learning in all domains, and school readiness and success later in school. As Carrie said, expulsion happens in all types of programs and to children of all ages, including infants. And so solutions really need to be multi-sector and consistent across all types of programs. And solutions must address implicit and explicit bias. We now have some evidence that infant early childhood mental health consultation can help reduce racial disparities in expulsion. This comes from some very recent work done by Eva Marie Shivers at the Indigo Center. And we'll hear from our speakers in just a bit about IECMH consultation. And last, we have really come to see that bans on expulsion that are not accompanied by program supports can actually be harmful. And this comes in large part from some very extensive research in Illinois following a ban on preschool expulsion. And what researchers found there was that expulsion actually did show a drop, but they saw that children leaving classrooms, ECE classrooms for behavior-related problems stayed about the same. And that was accounted for largely by parents withdrawing children because of behavior problems. And also planned transitions, which was allowed in the legislation. So in some ways, expulsion went a little bit underground, and it's probably harder to work with programs and address the problem when that happens. And of course, children in these situations are still being excluded when a program, for example, practices what people have come to call soft expulsion. That might take the form of a parent calling a program leader or teacher, calling the parent multiple times during the week, saying you have to come and pick your child up because of behavior problems. And then the parent might finally withdraw the child because it's just not a workable situation. So we'll go to the next slide, our last slide, and offer you some considerations for what we see as key elements of effective expulsion policy and implementation. And again, these really come out of our work with several states over the past couple years and the research. So the first of these elements of effective expulsion policy and implementation is a mechanism, often a centralized or regional warm line, that makes it easy for programs to ask for assistance when they have a child with challenging behavior and that child might be at imminent risk of expulsion. It's so important that programs know where to go for help and can get that help in a timely way. And secondly, if a state or region establishes that kind of warm line, it's really important that specialists staffing it can draw on the full range of professional development and IECMH consultation resources to offer program assistance that is really best suited to that program's needs and the child's needs. So we're really talking about the state marshaling the full range of supports that might be helpful to the program, the child, and even the child's family. Third, it's important to have an entity that can track the delivery of program supports and outcomes and collect data on changes over time in programs' use of exclusionary practices, especially by race, ethnicity, and disability status. That's helpful not just to know what's happening and whether the effort is effective, but also to be able to do continuous quality improvement and make tweaks over time in the supports that are offered and how they're offered. And last, we'd say that once those supports are in place, there's, programs are able to get to those supports, there's an entity that they can go to, such as a warm line, to ask for supports, then a policy can require ECE programs to use these supports. And so we think about it in that order: establish these supports, make sure the programs can access them, and then you can really establish a requirement that programs where a child is facing the risk of expulsion must ask for supports. And that is, we think a very reasonable policy solution has proven quite effective in a couple states. So with that, I will turn it back to Dan.
Great. Thank you, Sheila. Thanks, Carrie. So now I'm going to turn it over to Nikki, who's going to tell us about the work that she's been doing in Arkansas.
Good morning. Thanks for having me. I'm going to share my screen and y'all can tell me if that works. Are you seeing my slides? Great. Okay. Now I'm going to get y'all back where I can see you again. Okay. So I'm Nikki Edge, and I have the good fortune of directing our state's mental health consultation program, which sits as one part of our behavioral health system, which is what I'm here to tell you about today. That's the term that we use for our state's sort of single point of entry into expulsion prevention resources. So you guys will probably remember that around 2015, the Department of Education and the Office of Childcare at the federal level put out some recommendations that states should do something to try to limit suspension and expulsion. And so we, in 2015, established a work group to try to think through what some solutions could be in Arkansas. That was led by a dynamic public health leader here named Arlene Rose. And just to distill down our multifaceted work to kind of two of the most important points that I want to talk about today. One was that we created a policy or expanded a policy. And the other was that we created a support system that I'm going to tell you about. We did lots of other things around training and so forth, but I'm going to kind of zoom in on these two pieces. So we had in our state pre-K a longstanding policy that said, you should ask for permission from the Division of Childcare before expelling a child. What we knew from experience was that that was not super effective because it was a hurdle to clear. Like, you needed to call and ask, but when the state didn't really have anything to offer by way of support or help, then they were not in a great position to deny that permission to expel the child in cases when people are getting hurt and the system is stressed and people are really frustrated. And so, but we felt like if we expanded that and if we paired it with support, then it could be effective. So our policy is super simple. It just basically says that no child can be expelled without permission. And that policy was expanded to apply not just to pre-K, but to any program that takes state or federal funds. And that includes vouchers. So this policy was included in the voucher participant agreement that programs sign. And of course, Head Start has their own similar rules. And so that ended up covering about 75% of childcare in Arkansas. The other 25% of programs in Arkansas that are not covered by the policy can still access the supports. They're just not mandated to do so. So then the support system, which I'll tell you about over the next few minutes, is called Behavior Help, and we launched that in 2016 to be able to have a response when programs were kind of throwing up the flag and saying, hey, we have something going on over here and we need help. Disclaimer that I'm just now realizing on my slides. Our Department of Human Services Division of Childcare just moved to the Office of Early Childhood at the Department of Education. I have noted this on this slide and not on any other slide. So you'll hear me talk about DHS, 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 which is now Department of Education. Forgive the confusion. Okay, so we were creating in 2016 this new behavior health support system on the lean budget-wise, using as many existing resources as we could. We didn't have funding to create like a true hotline that would be staffed. We didn't have that kind of full-time staff available. And so we went with an electronic solution, which has proven to work really, really well for us. So behavioral help is accessed through the website that you see down below, and anybody, usually a teacher or director, but also a child welfare caseworker or a therapist or anyone, can put in a very simple help request that's like a little half-page electronic that just kicks the system off and alerts the Department of Education that there's a behavior-related challenge in a child care center. And so this is an overview of kind of the process and what happens next. And this is like a lot to take in on one slide, but we'll be kind of like breaking it down on the next few slides. But this is the overview of our system. So if you look at the top, it starts with that online help request. And whoever submitted the request gets a phone call from the Department of Education team within about 2 working days to complete an interview, which I'll tell you about in a minute. And those questions are designed to help the state identify what would be the most helpful next step, which team kind of to send in to support this situation. So it's a 3-tiered support system. The team at DHS, or now Department of Education, can handle things that are very routine. Most cases go to our middle tier, our team of technical assistance providers. And then when things are more serious or more severe, they come to the team that I have the pleasure of working with, which is our mental health consultation team. And so I'll kind of walk you through each of those pieces on the next few slides. So when that help request comes in, it is picked up by a little team at DHS. That this is something that they do in their other duties as assigned, kind of part of their job. They all have another role, either in family support or as a pre-K specialist or whatever the case may be. They pick up the request, they call the director or the teacher or whomever submitted the referral, they complete a structured phone interview that I'll tell you more about. And then they either decide that they can handle this request themselves. They do that in cases where it's like the first day of school and it's the child's first day ever in childcare and someone submits a help request, and DHS might say, I wonder if you want to think about this or that and maybe give it a few days. And if you're still struggling, call us back. Otherwise, they assign it to the technical assistance team or to the mental health consultation team. And then this team, you'll hear me talk about our Monday meetings. We all meet together kind of as leadership on Monday afternoons. And so this team is represented in that meeting. Okay, so in the structured interview that they do, which they enter into an online system that I'll show you, they're gathering information about the child care center, like what do we know about them? What's their quality rating? What's their funding? Are they under mandate to use our supports? What's their licensing history? What do we know about the teacher, her training, his or her experience? How long have they been with this child? They document some qualitative things, like just what is the level of frustration that they're hearing? Like how volatile is this situation? How kind of hot is it? They ask questions about like, so tell us about what you've tried with this child, and if they are hearing red flags related to behavior management, like that gets noted. And then what do they know about the child and the family and what experiences they have? Is this a child with an IEP? What do we know about their history? And they use that information. They have a little guide that says if we're hearing these kinds of things, if these kinds of red flags are present, it comes to mental health consultation. If it's a case that looks like this, it goes to technical assistance. If they're not sure, we staff it together in our Monday meeting and we make a decision, and we don't always get it right. And so we meet together every Monday in case we need to trade cases or help each other out. So the technical assistance team is out of Arkansas State University. They are a team that was already a contractor with DHS as a provider of technical assistance and professional development in many different ways. they kind of handpicked people from across their team that had the most expertise in social emotional development and kind of classroom management kinds of things. So some were trainers of a curricula, some were conscious discipline coaches, some were part of the general TA team. Some work with programs in their quality rating efforts. So now all of them take, or this subset also take behavioral health referrals as part of their duties. This team handles about 2/3 of the cases that come into behavioral health. And so for this team, a referral around a particular child created an opportunity to enter a classroom to provide support around classroom management, but the focus is not on a particular child. It's really on equipping teachers with skills that they need to create a more supportive classroom environment that is likely to benefit the child that generated the referral, as well as other kids in the classroom and kids in the future. And so they're really keeping their efforts a little bit more general. So when we see those red flags in the interview that tell us that no matter how equipped a classroom is, no matter how skilled a teacher is, whatever's going on is going to require some thinking about this specific child and about this specific family, some customizing strategies to a specific child because of the child's trauma, because of developmental delays, because of service coordination needs for the family, whatever the case may be, then we try to get that case to a mental health consultant. And so the services that you see on the screen, of course, only happen with parental consent and involvement, because we are working now at this more individual child and family level. We have a short-term model of mental health consultation, not because that would be our dream and our wish, but because we have limited resources, and we looked around at the research and tried to find out what's like the shortest proven effective options. And so we do 12 to 16 visits across 3 to 4 months, of course, with family involvement, observing, developing behavior and classroom management plans, screening, referring to community resources, doing a lot to try to support the well-being of teachers and directors, and just kind of typical mental health consultation, if you're familiar with that. We all use a cloud-based data management system that we all feed data into. So every team has a different part of the cloud-based system. So the state team does interviews and enters data. They assign cases within the system to the TA team or to the project play team. Our project play team has our own section of the system. Each consultant can only see their cases. And so all the data just gets fed in a confidential way, but that allows us to get the data that we need across the whole system. So this is a little bit of like what a typical year looks like for us in terms of the teachers and children and families that we're supporting. Every year we serve around 500 kids. Biggest year might be more like 600, but this is fairly typical for us. I don't know how big your state is, but to put this into perspective, Arkansas has just about 3 million residents. And I think about 2,000 licensed childcare programs. And so that, if that gives you any kind of reference point. Kind of consistent with what you saw from Carrie's data earlier, this is almost always boys. 80% of our referrals are for boys. In terms of our race and ethnicity, it pretty much matches our publicly funded enrollment in early childhood. So about 2/3 are non-Hispanic Caucasian, and then about 23% African American, and we have a small number of Hispanic and Latino families that we serve. You can see in the map, we're kind of this looks like a typical year. We're in all parts of the state, and then also consistent with kind of the national data. 4-year-olds are bread and butter. We did not start out gathering information on the interview that we talked about childhood trauma. We had a question initially in the interview that said something like, "Is there anything else you think we should know about this child?" And then this horror story would come out about the trauma that the child had experienced. And so we began more intentionally gathering that data as part of the interview. You can see the numbers on the screen, but I have to tell you, I've worked around child welfare for a long time. I've worked around, all kinds of systems that build capacity to support kids with experiences of trauma. And this is some tough stuff these kids have been through. And we're working to build understanding around that in our state, because often you'll hear a really, really sad story followed by an administrator saying, "But that happened last year, so I don't really think that has anything to do with what's going on now." And so we're doing a lot of efforts to try to change that. So here are our overall system kind of expulsion outcomes. Our expulsion rates, this annual report had it at 2%. It bumps around between about 2 and 4%. We were talking, Sheila was talking earlier about parent withdrawals. So you'll see that on there at 5%. Sometimes that's, of course, a parent recognizing that this center may not be of the quality that they need their child to be. And other times, of course, that represents more like a soft expulsion. But if we couldn't clearly document that, then it didn't go in the expelled category. When cases come to Project Play for mental health consultation, because we're working with parents' consent and around a specific child, we do more data gathering. And this, what you see on the slide, is just the proportion of kids at the beginning of consultation that on standardized measures of child's emotions and behaviors are scoring in the clinical range. And so I share that to just point out that there's some evidence we're getting our triage right, because they landed with Project Play and there really are significant clinical issues here. But also that this is not there. Of course, there are cases where it's like a toddler is biting or whatever, but there is also this proportion of cases in this system where these are very significant issues that teachers and parents are facing, and skilled support is needed to help teachers navigate this. I don't have it on the slide, but about 72% of the kids that are referred to Project Play also have screen as at risk for a developmental delay in at least one area. So it's complex situations. We gather data about we do a deep dive into externalizing, but we also do other areas of challenging behavior and also pro-social behavior. And we do see improvements in pro-social behavior across the course of consultation. And also increases in the perception of the teacher that they're better able to manage whatever is going on, and that it's having less impact on the classroom as a whole and on the other children. We gather satisfaction data, of course, and teachers really do love the support. They really, I think our teams, both the TA team and our mental health consultation team, does a really good job of partnering, helping people feel valued, helping them feel supported. And there are times that, of course, maybe behavior didn't really need to change that much, because maybe it was more a perception issue or a lack of understanding of child development. But whatever the case may be, teachers end up, I think, feeling supported overall. We have done some exploration of kind of who, we have a low expulsion rate, but who does get expelled and what are the disparities in that. So it is a low expulsion rate, and so it's a small kind of sample that we're dealing with of those that are expelled. The kind of good news is that we don't see the racial disparities that are represented in the national literature. Our hopeful interpretation around that is that because this policy and support system was in place to slow things down and bring support, then maybe people are less likely to kind of act on what might have happened, out of a difficult moment where implicit bias might be likely to come into play a little bit more. What we do see, though, are that expulsions are more common in settings that are lower quality on our quality rating improvement system, where teachers are less trained, particularly in our trainings around social emotional development. And then when they are exposed to more types of traumatic events or when they are in foster care. So in this study that you see on the screen, we found that children were making up 10% of our completed behavioral health cases, but represented 29% of those expelled. So that's something that we've really been digging into and working on, and have a whole nother initiative with Sheila and Dan and others around kind of looking at what's happening in childcare for children in foster care. And then the last thing I wanted to say is just our biggest lesson learned, our biggest point of success, I think what makes this all work is the coordination across the parts of this team that weren't working together prior to 2016, but that have been meeting weekly on Mondays for 7 years now. We cross-train, we trade cases, we consult with each other. Sometimes we work cases together. And then after a couple of years, we realized we really needed early childhood special ed at the team. And so they now come to our Monday meetings and kind of get involved on an as-needed basis when we're talking about kids that are being served in that system. And that has just been huge for us to sort of coordinate and really function as one team together. And so I think we're taking questions maybe later, so I'll stop that and stop sharing. And that's all I have for you.
Thank you, Nikki. That was really wonderful. And I know about the work you do, and I don't know, even learn new things every time you talk about it. So great to hear. And now I'm going to turn things over to Amy and Rita, who are going to talk about their work in Maine.
Great, thank you. Rita, do you want to go first?
Yeah.
You have the
yes.
background.
I'll start
go
off.
into the implementation piece.
Yeah. So hi, everybody. My name's Rita Furlow, and I'm the Senior Policy Analyst at the Maine Children's Alliance. And I'm going to share my screen and hope everything goes well. Everybody got that up? Okay, great. So we started this work, right? We're the Kids Count organization in the state of Maine and do a lot of work around early childhood issues. And back in 2013-14, we started just hearing a lot about kids who were having significant behaviors, who were being asked to leave classrooms, very young children, and we kept hearing they weren't ending up in better places after they had to leave. And so we just decided to bring together a group of people to see if what we were hearing was what other people were hearing. And we ended up working with Sheila Smith at NCCP and with in particular Margie Wallen, who was then at the Ounce of Prevention, which is now Start Early. And Sheila and Margie were just incredible, wonderful partners. And so we had an initial meeting and we invited maybe, 15, 20 people. I think 50 people showed up because once word got out we were having this, people started forwarding the email to other people, calling and asking, can I invite my colleagues? And it really was clear to us that this was an issue that a lot of people had major concerns about. So we had this meeting in early 2015 with Sheila and Margie, and brought together, they brought together really some research and background. We ended up after the meeting connecting with a new legislator, a new state senator who was interested in children's mental health. She partnered with us and submitted some initial legislation. And frankly, we all struggled a bit about really knowing what direction we wanted to go in. And so ultimately what happened was, frankly, At the time, we had a very conservative governor. The members of the Education Committee knew this bill probably wasn't going to pass. And so they ended up just sending a letter to the Departments of Education and Health and Human Services and asking them to work with our Maine Children's Growth Council and national partners to look into this issue. So what ended up coming out of that was a series of reports and documents, beginning with this social emotional learning and development report. And as I said, this came out with the Education Committee in 2015. And so we brought together a broad range of stakeholders and had, right, as I mentioned, Sheila from NCCP, Out to Prevention, 0 to 3, and the Yale Child Studies Center. And Sheila, a huge part of the project was Sheila doing a survey and Maribel, who's incredible, and really went out, and I think we had over 400 responses to really have people in the field tell us what they were seeing and what was happening. So that report was a key element to bring back to the legislature, to really say to them, this is a problem. Frankly, when we first started talking to them about it, they were rather incredulous that 3- and 4-year-old children could be having the kind of significant behaviors that we were telling them about. So providing the survey, the research, the data really helped us move this issue at the legislative level. We also brought together, did a series of policy briefs on these various topics around professional development, consultation, parent engagement, right, suspension, expulsion policies, and also looking at our early intervention system. And we kind of brought all of this together a year later at a statewide conference. We invited Walter Gilliam. Sheila presented the survey, and that really was a launch for sort of the next stages. And the highest priority out of all of the recommendations was implementing a statewide early childhood consultation program. So happy to share the work and the report that was developed. Ultimately, it took us really until 2019 to actually get the legislation passed. And we've continued to do some additional work to actually get the funding to go statewide. So I will now turn it over to Amy, I'm so excited that she has been implementing this program. So thanks.
Thank you. Thanks, Rita. My name is Amy Boyu. I am the ACCP program manager with the Maine Office of Child and Family Services, and we are an agency under the Department of Health and Human Services. And the unit that I sit in administers all of our early care and education initiatives, so our CCDF dollars, our childcare subsidy, etc. So that's where I sit, and it was my charge to take the work that Rita and others did and put it into action and make it a reality, and we've been working on that. I do want to say that I'm really glad to be speaking to Vermont because I am a former resident of Vermont. I lived there I see lots of smiles. I lived there for a year in South Burlington, and the second childcare that my son ever went to, who's now 13, was in Colchester, and we loved them dearly. Bay Kids, I don't know if they're still around, and I was so sad to have to move away from Vermont. So I'm really happy to be able to speak with you and return all of the lovely things that Vermont gave to us. So I'm going to share my screen. Come back, we want more people. I wish. Okay. Let me just turn this into presentation mode. Okay. So I'm a licensed clinician as well. So I part of how we run this program is as part of my role, I do the program management and implementation piece, but I also help oversee the consultants that we have statewide and provide them with model supervision to make sure that they're doing consultation with fidelity to the model that we use, which is the ECCP model out of Connecticut, and I'll tell you more about that. Rita did a fantastic job giving you the background of the legislation, which is where this all started. I will add that LD 997 funded a pilot of 5 sites for our early childhood mental health consultation program. And that pilot was supposed to end in May of 2023. And what happened was in the last regular session of the legislature actually passed another law that gave us permission to end the pilot early and expand statewide sooner than expected, and gave us the funding to do that, which was very, very exciting. So here's just kind of a big picture overview of the process. We've been doing and implementing consultation in Maine. As Rita talked about, the need was identified, and I think the top recommendation in that 2018 report was establishing an early childhood mental health consultation program or system in Maine. And we really looked at it, and we continue to look at it as a prevention approach and as offering support and resources to our providers. And that has not only a wonderful effect in, hopefully reducing suspension and expulsion and exclusion of children in childcare, in early childhood education, but we also look at it as a way to bolster our workforce development, because we offer professional development as part of our program. And we also look at it as bolstering program quality. And so it's not just about the exclusionary prevention piece for us, which is very important, but we also look at this as a wonderful wraparound support for the field in general. So once we got the charge from LG 997 to build this system, we took a look at what was going on nationwide. And as Rita said, we had Walter come up and speak. And once we did sort of that nationwide scan of what was going on and what other folks were doing, we really landed on the ECCP model from Connecticut as what we wanted to invest in. And I'll explain a little bit more why in a couple of slides. But it's the only evidence-based model of early childhood mental health consultation that we know of. And they have a 20-year track record in Connecticut. And so we felt like that was a worthwhile investment of our resources. And the state and the legislature gave us the nod of approval to do that, and gave us the investment of dollars and staff time at the department, created lines at the department so that we could implement this. Once we started getting the initial pilot going in 2021, I'm sorry. 2019 is when we started building this. 2021 is when we started actually offering services. We really, the trick of an evidence-based model is maintaining fidelity while tailoring it to your local climate. And similar to Vermont, Maine is a very rural state. We're geographically pretty huge. And so, we have 16 counties, whereas Connecticut has upwards of 30, I want to say, I don't know. And we certainly don't have the urban areas that Connecticut does. So we had to work very hard with our developers, and they've been fantastic, ABH out of Connecticut, in taking what we can to meet Maine's needs while not compromising the integrity of the model. And that's been our focus since we've started implementation. And now we're moving on to the sustainability phase of implementation, where we started statewide expansion. The funding for that began in January of 2023. And we went from our initial pilot sites and started hiring up for the rest of the counties in Maine. We are taking a county-based approach. That's just what works best for Maine, rather than a regional approach. And so once we're fully staffed, we'll have 16 full-time mental health, early childhood mental health consultants in Maine. Right now, today, we have 11 of those 16, which is, I'm sad about the 5 vacancies, but I'm thrilled that we have 11 because you all know about the workforce challenges. And we have seven of those 11 are in training right now and new to our staff. And it's very exciting that we're going to be able to expand to all those additional counties. So a little bit about ECCP. Of course, you can do some research on your own, but I'll just give you a little overview. They were developed, the model was developed in 2002 by Advanced Behavioral Health. We have contracted with ABH for training and technical assistance in implementing this model. They have been our hand-in-hand partners from the beginning. I've only actually met them in person once. We've done all of this over Zoom, which is fantastic. And it's the only evidence-based manualized consultation model. It's listed on the What Works Clearinghouse, and it was just listed on the California Clearinghouse about a year ago. And we're in the queue for 4E registry review, but I don't think that's been reviewed quite yet. One of the reasons we also decided to invest in ECCP is because it comes with a centralized data system. And that was very important to us so that we could monitor and track not only program fidelity, but outcomes. And we could do that pretty seamlessly because the data system came with the training and technical assistance. So we were able to collect and monitor and pull reports on our data right from day one of the implementation, which is important. And Maine is the first statewide replication of ECCP, and we're very proud of that. ECCP has been replicated in some counties in New York, I think Nassau County, but we're the first statewide replication. So we're building the plane as we fly it a little bit, but I think we're doing a pretty good job. So a little bit about the outcome data, which of course was done in 3 RCTs by Walter Gilliam. ECCP has significant results and outcomes in decreasing externalizing behaviors and impulsivity. So those challenging behaviors that are cropping up, and increasing our parent-teacher partnerships. So ECCP stands for Early Childhood Consultation Partnership. Partnership is in the title of the model. That is a very integral piece to what we do, is building those connections between parents and caregivers and providers, because we know those conversations about early childhood mental health and challenging behaviors can be very uncomfortable for people. And so part of what we are doing is building the bridge of how to have those hard conversations and come to a common understanding about the strengths and needs of kids that they're caring for. And in the studies, 98% of kiddos who were served by ECCP were not expelled at 6-month follow-up. We also do follow-ups as part of the model. We do 1 month, 6 month, and we just instituted 12-month follow-ups for all kids that we do child-specific consultation on. So another broad picture of our implementation process. I spoke to some of this. The way that we've structured the ECCP delivery system in Maine, we run centralized operations out of OCFS here, but we did 2 RFPs for mental health provider agencies in the local counties who actually employ and house the consultants. We felt that was very important to have local buy-in from those local agencies on the ground, and they know the climate best. However, those agencies and those consultants work very closely with me and with ABH to make sure that they are maintaining fidelity to the model and delivering services with high quality. So we kind of have this like triangular approach around consultants to make sure they get the support they need and that services are being delivered well and in a timely manner. It's a little tricky sometimes, but it seems to work. And consultants actually say, I was a little worried they'd feel micromanaged, but they actually say they feel really, really supported and that it's such a help for them to have so many resources available to help them in this work. Our initial RFP was for 5 pilot sites, and I'll show you what those were in a minute. And we selected those by doing some data analysis about kids who are in child welfare, gaps in behavioral health services in certain counties. That's how we selected the 5 pilot sites. And we formed a state partnership team with other state agencies and quasi-state agencies right from the beginning to really help smooth the way for ECCP and identify those areas for collaboration and partnership, and build essentially goodwill towards ECCP coming in, which I think was very important and key through the whole process. Once we've actually expanded this program, we're on the 2nd expansion now. We did a little mini expansion in May of 2021. So we started services in January of 2021. In May of 2021, we used some additional CURSA funding to add an additional 3 sites. Things were going well. We wanted to extend the service to as many areas as we could. So we bumped that up, the original 5 consultants up to 8. And then once we got the go-ahead from LD 533, we did a 3rd provider RFP to expand the program statewide. And now we're continuing to work on, the logistics and nitty-gritty of expansion statewide. So training, hiring, onboarding, all of that stuff. It takes our consultants a good year to get comfortable in the model before they feel like they have some expertise in it. So it's a lot of support and work in the beginning to get it up and going. And now we're really being able to focus on monitoring our quality, taking a deeper dive into our data and seeing what trends we're noticing, and being able to bring that back to the field. Here's where we kind of live in our provider network. One of the benefits of being housed at OCFS where we are is that we sit right next to our Help Me Grow team, which is another new program that started about the same time we did. And we sit with our childcare licensing team. So ECCP by design is voluntary. It is never to be mandated as part of a licensing plan of correction, that sort of thing. However, we work very closely with licensors who can identify providers who might need additional support and suggest ECCP as an option. And that has worked fairly well. And we also sit with our childcare subsidy partners, and they've been very helpful in getting the word out of ECCP as well. We work closely with our other state entities, so our early intervention folks at CDS and our public pre-K, which is run out of our Department of Education. We meet regularly to compare notes, give each other updates, identify hotspots. I was just emailing before this meeting with our public pre-K technical assistance person at the Department of Ed about a program up down east that needed some help, and we were able to serve them right away. So that's been really good. One of the benefits of being in Maine is that everybody seems to know each other. So that's been useful. We also have worked very closely with our Maine Roads to Quality Professional Development Network. So we've worked out a formal referral and triage protocol with them on, because they run our warm line. So if they get a provider calling into the warm line or requesting technical assistance, that sounds like a good referral for ECCP, we have a protocol for them to funnel that referral to us. And vice versa. We also refer folks and programs to TA for them as kind of a warm handoff when we're done with consultation and we feel like MRTQ TNTA would be helpful on their business practices or their policies or something like that for their workforce retention. We can refer them to MRTQ and do that warm handoff. And we work closely with the University of Maine Center for Community Inclusion and Disability Studies as well. They've been supportive. Here are 5 initial pilot sites you can see right up the I-95 corridor. Kennebec, Cumberland, Androscoggin, Penobscot, and Aroostook counties. And here's where we are right now with our expansion. You can see we currently have vacancies in all of the light blue counties, so that's where we're still trying to recruit staff. We were in Cumberland County for about a year, and that was by far our busiest county. No surprise, that's where Portland is. We did have some turnover there, so we're trying to recruit another staff. And I am happy to say I think we'll be having somebody start there soon, so we can get services back there. So we're in the midst of training and getting folks up and going in those new counties that are kind of the teal color and the gray color. Here's some of our data from services that we've done. The services, as I said, began in January of 2021, and I pulled data through the end of August. So we do classroom-wide consultation and child-specific consultations. We also have adapted the classroom consultation for family childcare providers or home-based daycares. So we offer them kind of a specialized program level service as well. We've done 125 classroom consultations and 18 of those family childcare consultations. The family childcare consultations we just started in September of 2022. So we've only had that up and going for a year. But our consultants have made some really great strides in engaging our home-based childcare providers who have been thrilled to get the support. Part of our model is offering free and accessible professional development opportunities. Each of our consultants does a certain number of trainings, open trainings over Zoom or in person every year. So we've done 88 of those, and 879 professionals have been trained, and they can get CEU credit for it. We also have worked out a process with MRTQ where programs that staff that participate in classroom consultation can get signed off for hours of PD credit on their registry account. So that's another bonus for people who are accessing our services because they're doing hard work with us. It's intensive. It's 12 to 14 weeks for a classroom consultation and a weekly visit. They should get some recognition of that. And so we've worked that out. We've done 198 child-specific consultations. That's about a 6 to 8 week service. And 19 of those are child welfare involved children. So again, OCFS also has our child welfare department. And so we can work fairly seamlessly with them in identifying kids who might benefit from ECCP. We actually have a process where I have a staff member who looks at our CWIS system and evaluates cases for ECCP referral, and then talks to caseworkers about funneling them to us because caseworkers are extremely busy. It didn't work so well when we were just relying on them to call us. So now we call them. We've done 222 home visits as part of child-specific consultations. That's a very important piece of our service. And we use the class. We use a couple of different things for our pre-post, and we collect data on that on our classroom consultations and our child specifics. For our classroom consultations, we use the class tool as our pre and post assessment. And for child specifics, we use the Achenbach scales, the CBCL, and the CTRF. We do those. So, you know, preliminary data, this is very, very early. 76% of classrooms improved in at least 2 pre-K class domains. And in toddler classrooms, 75% have improved in at least 2 domains in our class pre-post assessments, which I think is pretty good. We're encouraged by that. Of course, we want to climb higher, but we're encouraged. We did have a
I'm so sorry to interrupt. We're just to make sure we have enough time for questions. If you could take like a minute or 2 to wrap up.
Yeah. Yes, thank you. Sorry, I'm terrible at monitoring the time thing. I'm going to skip that. Well, I just want to highlight on this slide, we did do a process evaluation. We contracted with SRI to do that. That was just finished in May of this year. And through that data, this is where this comes from, this slide. It pretty much mirrors what our colleagues from Arkansas were saying and what Sheila was talking about, that you know, we get, I kind of chuckled when you said 4-year-olds are our bread and butter. Yep. We get most of our referrals are in that 3 to 5 range, and 73% of them are males or boys. Most of our referrals have come from centers, but our family childcare programs are also growing. We are also able to go into public schools to do classroom consultations in public pre-Ks and do child specifics for kids who are up to the age of 8. I'll skip over that. So some key learnings, I talked about partnerships, that's very important. And the data system I talked about, that's very important. Workforce is always a challenge. We've had to become somewhat flexible on this. All of our consultants are master's level, either mental health clinicians or educators, early childhood educators. Initially, we were only clinicians, but we have expanded that for master's level educators, and that has enabled us to find more staff. Maine's a very rural state. All of our consultants are kind of working out there on their own. And so it's been very important for us to build systems of support, not only for our consultants, but for the providers. We've had some providers tell us, I love having a consultant come, they're the only adult I see. And it's very important, it's been a very important resource for our providers. And I think the centralized oversight of our program management, especially where fidelity is so important, has been a bonus and been smart for us to do. So that's it. I'll stop sharing my screen.
Great. Thank you, Amy, and thank you, Rita. Those are great complimentary presentations there. And I'm going to turn it back to Jen, who's going to moderate, I think, the Q&A.
Yes, thanks, Dan. So if you have questions, if you could, again, use that hand raising feature. And when you are asking your question, if you could let our panelists know who you are and what your role is, so they can kind of take that into consideration as they answer your question, that would be great. Thank you. And Amy, I see you have your hand up.
Hi, everybody. Oh, wait, I was going to put my hand down. I wanted to say thanks for the presentation. I definitely appreciate the need to do this work and appreciate all the hard work you all have done, to support children and families' mental health. My question applies to both states. For Arkansas, I know that you all are using the early childhood education and early care environment inclusion indicators to look at high quality environments. So for both states, Arkansas and Maine, I was wondering first how you all measure or assess the fidelity of practice in those early childhood environments. And then second question, so sorry, it's a two-parter. Arkansas, I know that you are getting intensive TA through National Center for Pyramid Model Innovations, so pyramid model work. And then Maine is working with Pyramid Model Consortium, state level. So I was wondering how each of you are intersecting this work with the pyramid model work that your states are doing, because pyramid model does also include the infant and early child mental health consultation components. So those are my two questions.
Okay, I'll probably forget one question by the time I finish answering the other, but I'll try. So a couple things about pyramid model. One is that we have not historically been kind of like a pyramid model state, although we do have trainings that are kind of linked to that framework. We have found it to be really helpful, though, when anyone in our behavioral health system, TA or mental health consultants, enters the classroom, we do a teaching pyramid observation tool or a tippy toes, the infant one, just so that we can see across. Well, it's helpful to the TA provider to have that scan, or the mental health consultant to have that scan, but also it helps us have consistent data across our system to know where we just have practice issues. So we can tell you that in 25% of classroom, teachers rarely play with children, or that in 60% of classrooms that we're entering, they're struggling with transitions. And that's helped inform the state's training, needs. So even though we, haven't been a state heavy in the pyramid model before, it's been really helpful to drive training. As you said, we are excited because we were a new TA site. The lead for that pyramid model project sits on the behavioral health team in our Monday meetings representing special education. And so that's been a wonderful link. They are finding sites that are going to be pyramid model sites. We're super excited about that. What we know is that there will be some of our programs that will be ready and able to take advantage of that and thinking about being true pyramid model sites. And then we have a whole nother sector that is just not staffed or equipped or to kind of have that internal team. And so, but we're excited that that's going to be available and kind of part of the continuum.
So from Maine, actually, we're not a pyramid state. Connecticut is, and so they work closely with pyramid in Connecticut, but we are not a pyramid state, and we're not getting TA. We do use the class tool, as I said, to do our systematic observations, and we certainly have data from the individual domain and dimension level, and we're starting to have conversations with our other partners and other state agencies, like our pre-K program, who are also using the class, about how we can streamline our efforts and use the data effectively.
Thanks, Amy. And I should correct myself. I know it's the pre-K side that's been talking with Pyramid Model Consortium. So but thanks, I appreciate that.
Alyssa, I see your hand up.
Hello. Yeah, thank you for that presentation. Y'all, I love hearing what's happening on the systems level throughout the country and outside of Vermont here. I have like 7 questions, so I'm just trying to narrow down like where do I want to start, which is probably a shock to no one. For those who don't know me, I run Seed and Sow. I created a professional development program, and we offer virtual support with specialists. So we have occupational therapists, speech language pathologists, psychologists, et cetera, who offer virtual support to all of our teachers and programs. And then we have parenting support as well. I think, okay, question number 1, I'm curious what this has looked like from a sustainability perspective in terms of that balance between the like virtual or incoming TA via calls, et cetera, and then the in-person aspect of coaching and where you've looked to employ that in-person piece versus the virtual or phone-based side of things. So that's question number 1. I can pause and then fire as many questions as we have time for.
Yeah. The outside of the worst part of COVID, the only phone-based piece that we have is that tier that sits in the division of childcare, where they do the phone interviews, and then if they decide to handle a case themselves, which is like less than 1% of the cases, then that's going to be virtual support. The technical assistance and the mental health consultation is on site in classrooms, and except for some pivots during COVID. And we actually did a study with some of our colleagues around the nation about those virtual services and how consultants perceived their effectiveness. And basically, they don't perceive child-focused mental health consultation virtually to be effective, but lots of other forms of consultation they did.
For Maine, our 99% of our consultation and our interaction with providers is in person, face to face. We started implementing services right at the height of COVID during one of those first waves, which I don't recommend doing, but we did it anyway. So when we made a conscious decision from the beginning, we are going to push for in-person services in a safe way, following all CDC guidelines, because we wanted to set that as the standard, because we knew that was important. And we had some very brave providers who were saying, yep, come on in. And we've been able to do in person mainly from the beginning. We do have some virtual adaptations when needed, but that's strictly for COVID. And we actually did not have to employ them that much.
So the sustainability part of that, like, what does that look like financially from a sustainability aspect of like reaching every site, especially I would say in a rural state, as we encounter here as well, as you know, as a former Vermonter. And I second Sherry's come on back. But what does that look like in terms of having those in-person services employed throughout the state?
Yes, that is a great question. That is something we're continuing to look at and evaluate. We have some consultants that cover very large geographic areas. And so we do collect data on mileage and what they're doing and their time, and having continued conversations about, do we need to look at this differently? And in our two more urban counties, Cumberland County and York County, where most of our providers are, we actually have 2 consultants per each county because of the high level of concentration of providers. But you're right, those rural areas, it's you know, I have consultants who are driving 2 hours one way to get to a consultation. And they're happy to do it, but we have to be very careful about how we deploy them. Like if they do that, they only do one of those at a time, that kind of thing. So I can't answer the sustainability question yet. It's something that we're looking at.
I can keep going with questions, but also if anyone else has a question, feel free to raise a hand. Okay, great, I'll keep going. As was noted in all of the data, the like 4-year-olds coming in hot here, what is happening in both of your states to look at going upstream and looking at infant toddler, both from like teacher prep and support, and also skills and regulation support for our infants and toddlers, so that we're not seeing this uptick in 4s, and also looking at things like bias prep for pre-K teachers, so that as these kids are coming to them, we don't just have the sudden influx. Just curious what's happening there upstream.
Yeah, there's a lot happening in our state around infants and toddlers, kind of across systems. So we have a huge infant mental health push in on the mental health side in Arkansas. We have Medicaid policies that changed a few years ago. We've been pushing out trainings in child-parent psychotherapy and parent-child interaction therapy and those kinds of things. On the early childhood side, with our PDG, there's a huge push on infant toddler preparation and support, and kind of equipping those providers. So there is a lot happening there. You know, hopefully some of that will help. I think to some degree, though, when children are experiencing challenges and they just get big enough, or you know, whatever, like that's, I'm not sure I'm gonna expect to see that profile of our referrals will necessarily change much.
I agree with that. And as you know, as a clinician, as a parent, I was always like, it's not the terrible 2s, it's the terrible 4s when they get big enough. But you know, for Maine, for infant toddler work, that is something I definitely want to look into more and focus more on. We do serve infant toddler classrooms. We've done a couple of classroom consultations with infant and toddler rooms that have been, infant rooms that have been very successful. So I want to take a look at that and see how we can deepen that in other sites. In terms of our supports for infant toddler mental health, our colleagues at Children's Behavioral Health Services have been here at OCFS have been doing a fantastic job pushing out trainings for clinicians on PCIT and ABC, attachment and biobehavioral catch-up. The challenge is workforce and, you know, getting enough people in enough places to have those slots accessible to families.
And Amy from the Agency of Education just asked a question that I think actually dovetails well to your last question, Alyssa. So kind of the flip side of that, focusing on the infant toddler, then how is the work that you're doing in each of your respective states integrate or align with what is happening in K through 12?
In short, not well enough. So early childhood special ed is the main kind of point of continuity as we move out of early childhood and into K-12. So when cases are coming to mental health consultation, one of the things that we're working really hard to do is make sure that kids are not transitioning without having been appropriately screened, without pushing for IEPs if there's appropriate. It's kind of spotty in Arkansas whether you can get an IEP just on a social emotional delay without other developmental delays. So we work really hard to try to make sure that kids have protections in place as they move into the K-12 system. We do offer transition services. So, you know, if somebody's moving from consultation and moving into kindergarten, then we'll work on that transition and try to work with their kindergarten teacher on what has worked. But there's no parallel system outside of special ed. And so it's not as smooth or connected or streamlined as we would like it to be. And certainly like in our child welfare system, they're like, where's mental health consultation for our kindergartners, for our first graders? These problems are not just like magically going away.
For Maine, because of the way our legislation is written, we are actually able to offer child-specific consultation all the way up to age 8 in public elementary schools. So we just started deploying that last year, and we're, you know, kind of growing that gradually. I work closely with colleagues at the Department of Education from their offices of student supports to ensure that, you know, things that they're pushing out for social emotional learning and curriculum that we and our consultants are aware of, so that we don't inadvertently kind of contradict something that Ed is pushing, or, you know, vice versa. So
can I ask another question?
Let me just pause and yes, if no one else, does anyone else have any other questions? And I think we have time for one more.
Okay, I'm curious what it looks like for folks reaching out. Is it predominantly directors, providers, or are you seeing teachers reach out for support as well?
For us, it's a mixed bag. Often it's directors, but sometimes they'll just task the teacher with reaching out, or a teacher will reach out on our own. We get child welfare caseworkers that reach out. We get therapists that reach out when like a kid's in therapy and the therapist is hearing that there's challenges on the childcare side. So we try to encourage all parents reach out as well.
same for us. It's a mixed bag, and I've seen an increase in referrals from primary care, so pediatricians and behavioral health coordinators in primary care offices, because we have long wait lists for mental health services, and so these folks are trying to fill the gap somewhere. So we're getting calls from pediatricians.
I will say that a lesson learned for us with our open referral system is that we finally tasked like a special person with doing all the interviews and case assignments associated with a referral that's not coming from a director or teacher. Because if it's coming from the parent or a therapist or a caseworker, and the center is not asking for the help, that's a delicate dance to try to then call the center and be like, we've been made aware that there's, you know, a child experiencing some challenges, and would you be interested in support? And so that requires a little careful navigation.
I just want to thank all of our panelists so much for lending us their time and their knowledge today. This was incredibly helpful. Thank you so much. And I'll turn it over to Sherry to wrap up the meeting.
Yes, thank you all for the meeting. A couple of things. I just want to say, Nikki, I came to your presentation in Chicago last year, where a administrator who had lived in Arkansas but now lived in Illinois stood up and said that the system had changed her life. And really spoke very specifically about how it had helped her and her team. It's one of the reasons I've been trying to get you to Vermont since then to tell us about what's going on. And Amy, yes, we will help you find a house maybe if you'll come back, because we do. It's great. Thank you, everyone.
I let my Vermont license lapse. That might be a problem, but
we can help with that too. Amy Murphy's here from AOE. And Dan and Sheila have been working with us with Let's Grow Kids team over the course of the year. Just really great knowledge, and we're happy that we were able to bring to this group of over 50 people, Vermonters interested in this topic. And I think we'll make some space at our next early learning and development meeting to maybe sort of process some of what we heard and what we might want to know more about. So thank you to everyone for that. I just also want to say I might need to update the meeting invite. So I just don't want you that regularly get these meeting invites to be confused, because I know they had trouble today letting people in because I was a teeny bit late. So I might need to update that with a different email for a co-host. So just don't want to create confusion when you see things being canceled and rescheduled. And I don't know if anyone else on the coordinating team has any other announcements, Dawn, Jen, S, or Beth, before we sign off.
I will share really quickly that we're opening up a new round of Make Way for Kids grants, working in partnership with Let's Grow Kids and First Children's Finance, and the application should be going live next week. So.
Thanks, Jen. So those are for capacity grants. Right. Well, thank you, everyone. Thank you, panel. Thank you, Jen Horowitz, for coordinating this, and we'll be seeing you all soon.
Thanks so much.